A hiatal hernia is when a portion of the stomach herniates or goes into the chest. Normally, the stomach lies below the diaphragm. The esophagus joins the esophagus or the feeding tube joins the stomach right at the diaphragm. With a hiatal hernia, where the esophagus or the feeding tube goes in below the diaphragm, you get a big hole in the diaphragm, and then the stomach starts pouching up into above the diaphragm to where the lungs are. This is not a hernia that you can feel, but this is a hernia that can be seen on studies, and most of the time we'll know, we assume that you have a hernia because of the symptoms that you develop. Symptoms related to hiatal hernia is mainly reflux, acid reflux. You start to get heartburn. The heartburn is usually worse at night, especially when you lay down and go to sleep. Some people have to put pillows and sleep sitting up to avoid the acid from coming up into their chest. They rarely cause any pain. The main problem with hiatal hernias is the acid reflux. This is a hernia that you cannot prevent from happening. This is not related to heavy lifting or exertional activity like the other hernias that we have. Hiatal hernias are often seen on CAT scans when CAT scans are performed for other reasons. And this usually means nothing. The only time you really need to worry about a hiatal hernia is if they're causing you symptoms. If you suspect that you might be having that you might have a hiatal hernia based on those symptoms, based on having reflux, then the next step would be to show that indeed you do have a hiatal hernia. And the best way to do that is with a scope, what we call esophageal gastroduodenoscopy, where they put a telescope down through the mouth and look into the esophagus and look into the stomach, and by that we can tell whether you have a hiatal hernia and how big that hiatal hernia is. That test will also show whether the acid reflux is starting to cause any problems in the esophagus, like inflammation. If the hernia is not treated and patients continue to have reflux, that will cause irritation of the esophagus and will cause esophagitis and inflammation, and that can cause pain. That can also cause bleeding. If the irritation and inflammation goes on for a very long time, that could even lead to precancerous issues and sometimes even to cancer. The first line of treatment for hiatal hernias or for patients with gastroesophageal reflux is medications, acid medications. Patients will often be tried on those for about 3 months to 6 months. If those help or resolve their symptoms, then that's all they need to have done. However, if the symptoms continue despite the medications, or if the symptoms recur after stopping the medication, then you may need an operation to fix the hernia and place the stomach back where it belongs. In terms of the operation for a hiatal hernia, we can usually do it laparoscopically with just 4 little holes. It's about an hour and a half operation, and most patients can go home the following day or sometimes even the same day.